It's been a long and difficult night for a lot of people, none more so than the residents of Binjari. As was reported last night, there were 9 positive cases detected from Binjari yesterday following the testing blitz. There are 4 females, a 23-year-old, a 38-year-old, a 39-year-old and a 78-year-old. The 5 males are aged 17, 18, 21, 31 and 47. They are from different households. We think 6 in total. Their vaccination status has not been confirmed yet. The 78-year-old female was at Katherine Hospital with symptoms and she was transported to Royal Darwin Hospital overnight. The other 8 cases have all been transported to the Centre for National Resilience overnight for monitoring and care. Some have existing health conditions. There have been no new positive cases in the Territory since last night's update. There are 3,005 tests processed in the Territory in the last 24 hours. The positive cases in Binjari are very concerning, but not surprising. As I flagged with you yesterday, this is something we were expecting based on the wastewater results. What's more concerning is the evidence of substantial mingling between households in Binjari, as well as mingling back and forth between Binjari and the nearby community of Rockall, which is about 130 residents. These communities have very strong personal and family connections. It probably helps to think of them more as one big household rather than a lot of different households. For these reasons, we do expect the numbers in Binjari and probably Rockall to increase, and they may increase by a lot. We have to be prepared for that. As you know, last night we took urgent action to escalate our response in these communities, immediately implementing a hard lockdown. That means residents of Binjari and Rockall no longer have the 5 reasons to leave their home. They can only leave for medical treatment in an emergency or if required by law. Yes, these are strong measures, but the threat to lives is extreme. An expanded rapid assessment team was deployed to Binjari and Rockall last night to help with the hard lockdown, begin the contact tracing work and provide as much support as possible to residents. This includes providing food and other essential items to residents. The effort undertaken by our teams last night and the cooperation of Binjari and Rockall communities was nothing short of phenomenal. I want to especially mention the Worley staff member Peter and his team who facilitated this last night. They were exceptional. Thank you. It's highly likely that more residents will be transferred to Howard Springs today, either as positive cases or close contacts. We've already identified 38 close contacts in Binjari and that number will go up. Those 38 are being transferred now. I contacted the Prime Minister last night. We are grateful for the support of about 20 ADF personnel as well as Army trucks to assist with the transfer of positive cases and close contacts and to support the communities. We are doing an assessment today of what extra resources we might need from the Feds and the Prime Minister is ready to help further. I thank him and the Australian Government for that. Exposure sites will be updated on the website as the contact tracing continues today. We'll also keep testing and doing vaccinations in Binjari and Rockall. We did 29 vaccinations in Rockall yesterday, 27 were first dose. I'll give you an update on wastewater now. Apart from Binjari, there is still positive wastewater in one Katherine catchment, the Bicentennial Road catchment. That's the area around Acacia Drive, McFarlane Primary, the police station, the industrial area. That's the area around the highway out of town, east of Katherine. It also includes the Walpree Town Camp. Given we have removed the positive cases identified in that area, it does concern us that we're still getting positive readings there. That means it is likely there is still a positive case or cases in that part of Katherine who have not come forward for testing. If you live in Katherine, particularly that part of Katherine, Katherine East, please get tested today. We only had 221 tests in Katherine specifically yesterday. There has been an emergency text alert sent to residents in that area this morning calling for them to get tested. We're sending more resources to the Katherine East pop-up testing clinic today and we will be doing door-to-door testing in Walpree. There are 11 other catchments in Katherine and they are all returning negative wastewater results. Yesterday I told you about a presumptive positive that was detected in the Marlow Lagoon catchment. The second test has come back negative. That is good news. The close contact numbers now stand at 385, an increase of 30, and it will go higher. 11 close contacts are yet to be located. 314 negative results have been returned so far. We've identified 5 additional close contacts in Borroloola that had not previously been known to us. They have all tested negative and they are being transferred to Howard Springs. What has become clear to us, based on the level of movement that's been happening in some communities outside of Katherine, is that there is a real risk that the virus has seeded to other connected communities further away. Given this risk, today we are issuing a mask mandate for communities in the West Daly and Roper Gulf local government areas. This includes the communities of Borroloola, Barunga, Beswick, Daly Waters, Mataranka, Pine Creek, Binjari, Nooka, Numbawa, Yarralin and Karkarinji. Everyone in West Daly and Roper Gulf, masks are mandatory. That means residents are required to wear a mask when outside their home if they are not able to keep a distance of 1.5 metres with people they don't live with. That's where we stand this morning. Concerning developments in Binjari, but pretty encouraging news elsewhere. We will make a decision on the broader Katherine and Robertson River lockdown tomorrow morning once we can be a bit more confident that Binjari is contained. At this stage, there is very little chance of Binjari and Rockall exiting any form of lockdown in the next few weeks. For the rest of the region, I said this yesterday, and I want to repeat this for Katherine residents. If and when the lockdown ends, it won't go straight back to normal. It will be a transition out of lockdown. That most likely means that we'll go into a lock-out footing. So fully vaccinated Katherine residents will be free to work and move about, but residents who are not fully vaccinated would have to stay in lockdown for a little longer. That is the scenario we are hoping for. That is what we are working towards. But as I said, we will keep working today and be able to make that call tomorrow. Just one final point. I want to remind everyone who is yet to be vaccinated, but particularly Aboriginal Territorians given our current outbreak. It's too late for the vaccine when you've got COVID. It's too late when you're in hospital struggling to breathe. It's too late to get the vaccine when you're hooked up to a ventilator. The vaccine won't save you then. Robertson River is a high-vax community, and after more than a week of testing, we are at 7 cases with a larger population. None of them are in hospital. Binjari is a low-vax community, and we discovered 9 positive cases in one day, and 1 is already in hospital. Binjari has a smaller population than Robertson River. Please get vaccinated. Once you catch the virus, it is too late. We need you to get the vaccine now, before you catch the virus, so you can stay safe, stay healthy, stay alive. Thank you.
Thank you, Chief Minister. Thank you again for coming. So we have 9 cases now in the Binjari community, as you've heard. That we were expecting more cases, but this number is greater than we were hoping for. And the spread amongst families is clear. There's 6 or so families in which this is now spread. So as the Chief Minister said, we will now expect to see more cases there. And we've had a number of people had to now go to hospital. We've got 3 people in hospital. The current situation is clearly concerning. However, in Katherine, apart from the remaining Bicentennial Road catchment, the wastewater has returned negative. So I am hopeful that we're getting on top of it in Katherine. However, we have to track down the reason for that Bicentennial Road positive wastewater. So there'll be an extensive testing effort today and over the next 24, 48 hours. I repeat the Chief Minister's appeal. Please come forward to be tested. We do need to track that down. If there is someone or people in the community there, we need to identify them. Otherwise, the potential for spread is, again, you can see the potential. It's very significant. The mask mandate, thank you for your cooperation with that. That is an important measure. Masks do protect the individual and they protect others. So I'd ask people to comply with that. I'll just give you a brief update on the 3 cases. So the most recent case who's been hospitalised is in her late 70s, and she has moderate to severe disease like the previous lady. I'm pleased to be able to say that the previous lady that we've reported on over the last few days is starting to improve. Thank you.
It's been a very busy night for our front line, getting out on the ground and ensuring that the people of Binjari and Rockhole are safe. We set up a police forward command post that will operate all of our multi-agency response to those communities. The rapid assessment team has hit the ground already for Rockhole. We'll do some deep assessments on there. We've had community messaging going out overnight through the loudspeaker of the community, significant patrols through the communities overnight, and the feedback has been that people have been very compliant. So I really do want to pass on my thanks to the community members for that. We're conscious of the fact that this can have some impacts for people's mental health as well as their general well-being. Know that we're on the ground. We will be supporting you. You will see a lot of people from various agencies on the ground. If you need assistance, just make contact with us. We'll make sure that contact is minimised. All of our people will be on the ground with appropriate PPE. We've already secured meals for people for the next 72 hours, and that will be ongoing through the duration of this harder lockdown. It is important for people in those communities to please stay at home, stay within the boundary of your residence, engage with us. We're there to help you. If you need anything, just keep the lines of communication going. The testing is going to be vitally important, and as we're seeing now with Robinson River, it's not just one test. We'll loop back for day 5 tests and the like, and again, the compliance from Robinson River, I have to continue to acknowledge that community and their cooperation. It has just been fantastic. The teams on the ground from a frontline response, we mobilised significant resources overnight and this morning. There's teams now heading down to bolster the rapid assessment teams on the ground for those communities. They're mobile as we speak. They should get into Katherine by about 1 p.m. this afternoon and provide much needed surge and respite for those frontline people. Moving about 30-odd police officers, some from Darwin, some from Alice Springs, to Katherine to ensure that we've got appropriate incident management oversight there. There's lots of moving parts. As you know, we're moving people from Borroloola, we're moving people from Katherine and the like into the CNR. So logistically, very, very challenging, but I'm proud to say our people are standing up incredibly well and being driven for the cause that they're here for, and that's to serve and protect. It's an exceptional performance. We need to make sure, again, that compliance is good. Generally, the feedback overnight was that Katherine had improved. Unfortunately, we had 3 individuals, 2 adults and a youth, break into a licensed premises and try and steal alcohol. We managed to interfere with that behaviour, and they've been taken into custody as a result of that behaviour. But general compliance was okay. We had 7 infringement notices for the period. I'm very hopeful that we won't have to issue any further infringement notices and that compliance will come through. To the protest yesterday, I actually want to pass on my thanks to the organisers and the participants. Whilst I needed to have a police presence there, the compliance was generally very good, outside a couple of little hiccups, but nothing of any major consequence. So I do want to pass on my appreciation. We do try and create an environment where you can protest lawfully and peacefully. So I appreciate the fact that that was how yesterday went down, and look forward to that being a continuation into the future events. The ADF requests have gone through. We're going to need significant resourcing to ensure the provision of food and looking after people on the ground, as well as those that we're moving through. Obviously, pulling out 30+ people from Binjari alone as close contacts is a logistical challenge. And again, we understand that the support we're getting from the community is very good, and people are understanding that we will ultimately get them there. Advice from the CNR is everything is going on pretty well within those who are there. There's a pretty good sort of attitude there, and people are understanding of why they're there. And of course, when you hear 9 positive cases come from a community of that size in the development of 24 hours, it just shows, again, the demon we're wrestling with. So broadly, my thanks to everyone involved. Please keep up the good work. To those who are going to be impacted by the mask mandate, please comply. It helps us to help you. Thank you.
So what are the vaccination rates in Binjari and Rockhole?
They are ARCHO communities. I can't give out the specifics of the vax rate. I don't have that permission. But we will consider both of them below 70% first dose. I think we're allowed to publicly say that. So that they're considered low vax communities, but I can't divulge the specific vaccination rate in those communities.
A long way below 70%?
I'm not going to get into that Again, we've got cooperation now with the ARCHOs. For our planning purposes, we know the vaccination rates. I can talk about the vaccines I've delivered there, and I can talk about below and above 70%, but they're considered low vax.
And how has the cooperation been with the community? What is the general feeling there? Is there stress amongst the community, or what's that like?
So the cooperation has been amazing. Worley need to be thanked a lot as the ARCHO provider in that community. They've played a significant leadership role in what has been a very difficult circumstance. You can appreciate it. Already in lockdown, obviously, so not a surprise to them in some ways, but hard lockdown, family members who have got COVID, that's traumatic in and of itself, and then having to be advised on a stricter form of lockdown. I think you can all understand the impact that has on a community. The people within both Binjari and Rockall have been superb. All reports on cooperation has been, full ticks. I've not heard one significant or any kind of issue at all. I might pass to the Commissioner to add to this, because it's his and Dr. Payne's people on the ground there, that it's all been fantastic from everybody in Binjari and Rockall, from Worley, from all the frontline staff. Everyone knows what the problem is and how to work through it.
You mentioned that close contacts are being moved to Howard Springs. What is the level of close contact that's required for this movement? Is it family members, household members?
Yeah, so there's a couple of different things that decide what is it or isn't a close contact. A household member is basically automatically a close contact, be fair to say, with the risk. I haven't interrupted the tracers to say explicitly why is this one a close contact or not, but be fair to say households absolutely grounds for it. It would go to the extent of movement they've had and how much time they've spent with individuals that would help us to find that close contacts. I expect more close contacts to be identified. I wouldn't be surprised if we get to a conclusion that the whole community is close contact potentially, but at the stage it's 38.
And just to follow up on that, are people, you say close contacts move to Howard Springs, is that a mandatory measure? So
it'd be the health advice to put them under our control, make sure we've got the testing regimes, easier for us to support them in that circumstance. Sometimes a close contact may not want to move, and then there's an assessment made about whether they're in an appropriate house for that. So that's in any lockdown or situation we've made those calls in the past. Sometimes where you are, it's perfectly okay to be a close contact in that premise. You might be on your own, easy to look after, easy to stay isolated, and that could be acceptable. But we genuinely have a principle. We prefer to have close contacts come into supervised quarantine where it's easier for us to take the tests, get the results back and look after that person. But it's not always mandatory. Sometimes the CHO could direct, sorry, we really do need you to come into supervised quarantine, your premise might not be appropriate, or some other reason that can happen.
Can there be, are there any plans to make alternatives so people aren't removed from country to Howard Springs while still meeting health requirements needed?
So that can be an option at this stage. I've had no requests to stay on country, if that makes sense. I think people understand that moving to Howard Springs is about providing them the best care and support that they need. So there's been no on-country request. I'm not sure if you want to add to that, Dr. Payne. I'm not aware of any.
No, I'm not aware. In fact, what we are aware of is that communities generally do want those who are contacts or cases to be outside of the community, so there's the potential for spread is reduced. So there's been a lot of cooperation from that point of view. And I'd just like to reinforce what the Chief has said about the Binjari community, that they have been wonderful, but also the staff. I keep saying this at these meetings, that our staff are working around the clock. They continue to work around the clock. They're working extremely hard, and particularly last night, there was a dedicated team who have been continuously working for several days. We are, of course, rotating them as much as we can, but we have a limited number of staff. But I'd just like to thank them sincerely for their efforts. As I've said before, they're very proud of what they do, but they've done a tremendous job. Thank you.
Was Rockall part of the lockdown orders that captured Katherine this week?
Yeah. I'll go back one step. We did 27 first doses in Rockall yesterday, so Rockall may or may not be above or below that 70%. I might need to fact check that one, because we did do the 27 first doses in Rockall yesterday. Rockall is part of the existing Katherine lockdown, so both Rockall and Binjari were part of that lockdown, so that's one comforting thing. As I said earlier, you could probably think of Rockall and Binjari as large households, and so there has been mingling within both those those areas. It's just a statement of fact. They're not in trouble or anything for that. It's just an acknowledgement of mingling, and that's one reason why we've gone into a harder lockdown to try and make sure we can keep top of the spread as far as we can.
Any tests still to come back for people in Binjari, or have any people gone to Rockhold from Binjari without being tested?
So the Binjari community got fully tested. All those results came back. We've got 9 positives. We'll do more testing, and obviously of the close contacts, we'd suspect some of those will turn positive, and there'd be an expectation some of those other tests will turn positive as well. So we'll keep testing the Binjari community. We will have a full testing suite done of Rockhold today, but tests have obviously been done previously in Rockhold. I might get the Commissioner to touch upon some of our testing and vax efforts through both those communities and Warlpiri Town Camp. I just finished this question.
The work through the contact traces has indicated that feedback from some of the people who have tested positive in the close contacts that there has been some mobility between the two communities. As a result of that, we're pretty confident that Rockhold is likely to have some transfer and positivity. So the surging has pretty much made sure that we've got the testing commencing almost immediately on the ground in Rockhold today. Those numbers continue to climb, but we're literally going house to house to house, ensuring that everybody who is currently populated in both those communities is going to be tested. And as I hasten to add, they'll all be subject to day 5 testing as well. So this will be in place for quite a period of time.
Effectively, are those 2 communities under lockdown and waiting for test results, or are we looking at 5 days or 14 days?
Oh, okay. It'd be fair to say we make our decisions usually in replication cycles. So we'd be looking at a 14-day rep cycle decision for Binjari and Rockhold. Depends a little bit on what days the day you count it from. While we're still doing this testing and getting positive cases, for all we know, the 14 days for their lockdown hasn't been determined yet. Doesn't mean they'll be in a hard lockdown for a full 14-day rep cycle either. It might be a reversion back to the previous lockdown decision, but I would suggest that we're going to be in a posture in Binjari and Rockhold of lockdown for at least 14 days from yesterday. That would be the scenario we're working towards. We might get more positive cases that might reset the rep cycle. It might be different forms of lockdown or lockout. It depends how many cases get moved to Howard Springs. There's a lot of things we've got to work through, but I felt we needed to flag that there'd be some form of lockdown probably for 2 weeks in Binjari and Rockhold today.
It's already been referenced that there might be severe mental health strain, a lot of trauma associated with these measures. Has there been any plans to step up mental health services or other cultural and community services to manage people through this?
So they're both Worley communities, Worley being amazing. As part of any primary health response, those things that can be considered. So that might be more individual client conversation. And obviously, if ever necessary, we can do more general service delivery within a community, but at this stage probably the most important response is the specific COVID response, but Worley and the team on the ground will be able to recognise if anyone needs any special kind of assistance on top of that, that would be a handle. I might get Dr Payne just to add a little bit to that.
Yes, so as the Chief has said, the Worley will make those assessments, and it's their these are their clients and their community. And obviously our teams will be as well, our health teams, their health staff will be making their own assessments, and we will, through Katherine, Health Services, provide any support that's needed.
Dr Payne, what's the likelihood, what are you expecting over the next couple of days?
Yes, good question. Well, it's always rather hazardous to predict, isn't it? I'm very reassured that we have acted early in Binjari. The wastewater testing signalled to us there was something happening there, and we went in hard and wide straight away. So the numbers we're seeing are a little higher than we thought, but it just shows that the spread had occurred within that community. So I think we'll see definitely more cases there. We may see some in Rockhold, which are already under lockdown, and we'll go into hard lockdown there. Those are going to be contained, so I'm fairly confident about that. As to Katherine, that's a little bit of an open book still. Without knowing where this came from in Katherine, and without knowing why that wastewater is still positive, testing really needs to come up. We really need better testing there to be confident of that, as to where that's going to go. Robinson River, that's been an incredible success story. As the Chief Minister has said, we were very fortunate about the vaccination rates there. So I don't expect to see more there, but there may be. But again, that seems well contained. Borroloola, we were worried about that, but we've managed to track down the people that were contacts from Robinson River, and they've tested initially negative. There may be some more cases there. We've got to keep an eye on that. And then across the territory, particularly in Central Australia where people have travelled, we have to keep a very close eye. It's a pretty optimistic picture given what we faced, but I don't want to be at all complacent, and our staff and the Territory Controller, the government, are very conscious of the potential here. So we won't let our guard down at all. But I have to say, if you ask me how I'm feeling about it now, I'm feeling quite optimistic. But it only takes another case in the wrong place for us to be chasing after it again. Thank you.
Commissioner, can I ask you a quick question, please? Commissioner, how sustainable is the continuation of police resources at these weekly protests?
How's the, sorry, Tony?
How sustainable is the continuation of police presence at these weekly protests?
Well, again, we do have to plan for these things because, unfortunately, trust was breached. We saw that with the assaults of my officers by those participants in that fateful march. I would much rather not be diverting my resources to that, particularly given the threat to true lives and Aboriginal lives in the Northern Territory that currently pervades. As I say, I am being quite fair and open in respects to the fact that I acknowledge that their efforts yesterday were far more compliant, they were lawful, they were peaceful, and that's appropriate, and that's something that we can support, and I don't need to send as many resources. But unfortunately, there have been elements attached to those groups that have sought to cause harm to my officers, and that's not something that I will under-prepare for.
Commissioner, it's going to be 40 degrees in Katherine today. Those houses are probably crowded. You used to run the housing department, as you know.
Correct.
Do you think keeping people in those conditions for up to 2 weeks is going to encourage them or maybe give them a reason to not follow the conditions?
No, I don't. I think experience has dictated that they know that in times like this, police most certainly an organisation that they have complete and utter faith and trust in, that in emergency situations we're going to be there to provide support to them. And moreover, I think they know that the whole multi-agency approach that's ultimately rolled out, we will not leave them by themselves. We will certainly be there, and we're there in numbers and significant numbers, so they know that they're well supported. The point about the mental health is one that I proactively raise because it's already something we factor into and are critically conscious of. We want people to know they can communicate to us if they need support, and we will make sure that we do everything we can to do so. We've got a real life example in Robinson River. Again, you know, the interplay with that community, the responsiveness, they understand the seriousness of this situation. The compliance overnight from Binjari and Rockhole tells us that that community has got the message. We sent them text messages, we sent messages via loudspeaker, we had patrols driving through the communities last night. I think there's an overwhelming understanding that we are genuinely there to help, we genuinely care about them, and we will do whatever we can to try and make their lives more comfortable over this period.